So, hello. This presentation will be on how to prepare for your ear, nose, and throat surgeries. My name's Aimee.
My name's Amy.
My name's Jennifer.
My name's Celine.
And my name is Isabella.
So, to start off, we have some learning objectives. So first, by the end of this presentation, the patient will be able to describe the preoperative goals to achieve before their surgical procedure. By the end of this presentation, the patient will also be able to identify 3 postoperative goals to follow after the surgical procedure. And lastly, by the end of this presentation, the participant will be able to reflect on why staying committed to following post-surgical instructions is important to their recovery process. So first, we'd like to ask you to take this pre-quiz just to know how much you already know, and that way we can then reflect afterwards again by taking the same quiz.
So, what are ENT surgeries? Starting off with tonsillectomy, this is a surgery done to remove the tonsils, and it's also used to treat inflamed tonsils, and it's also helped to treat people who have a hard time breathing as they sleep. Moving on to myriadectomy, this is a surgery where a hole is created in the eardrum to remove any trapped fluid from the middle ear, and sometimes a small tube is placed to help empty this fluid. It's also used to treat frequent ear infections. And for endoscopic sinus surgery, this is a surgery done to remove any small pieces of bone or tissue that can be blocking the sinuses. It also helps alleviate nasal congestion, difficulty breathing, or any recurrent sinus infections. Here are some things you need to know to prepare for your surgery. Make sure you have somebody that can drive you home after the surgery. Also, make sure to tell your doctor of any pills, medications, herbal remedies, vitamins, and supplements you're taking. Make sure to understand the risks and benefits of the surgery. Make sure to not eat any solid foods before surgery and only drink clear liquids until 2 hours before the surgery. Make sure to stop taking aspirin, ibuprofen, Aleve, Advil, or just anything that says like NSAID. Also, make sure to stop taking the St. John's wort 2 weeks prior to surgery. Make sure to also come in shower before you come in, and make sure to not apply any lotions, perfumes, deodorants, nail polish, or jewelry. Also, bring with you a picture ID along with your insurance card, and make sure to use the hospital provided chlorhexidine gluconate wipes to cleanse your body before surgery. Here are some things to expect after your tonsillectomy. You can have some throat pain as well as pain swallowing 1 to 2 weeks or longer. There also may be a white coating where your tonsils used to be, but this should disappear after 2 weeks. You may snore 1 to 2 weeks after surgery, so you replace a humidifier by your bed, so this can help with your breathing. You may also have changes in voice, but it should go back to normal in 2 to 6 weeks.
So what to expect after myringotomy? So there's gonna be pain or discomfort in your ear, and then your ear is gonna feel. So what to expect after myringotomy? So there's gonna be pain or discomfort in your ear. Your ear is gonna feel clogged, and you're gonna have some muffled hearing. However, your hearing should return after 1 week. And there's gonna be clear or yellow fluid that may leak from the ear. And then what to expect after endoscopic sinus surgery. There's going to be swelling in the nose, your upper lip, cheeks, and around your eyes. You're going to feel some numbness in the tip of the nose, upper lip, and gums. And there's going to be a drip pad that's placed directly under your nose just to collect any excess leaking mucus and blood. And then your nose is going to feel sore and stuffy for several days. And then you might have difficulty smelling for 1 to 2 months. So now we're going to go over post-operative instructions after your ear, nose, and throat surgery.
So here's a general overview overall of what to expect during your post-operative care or your recovery process. You should expect or you should get plenty of rest and allow yourself to get 7 to 8 hours of sleep. You should also avoid large crowds and avoid coming into contact with sick people to avoid the risk of infection. For 2 weeks after your surgery, avoid doing activities that make your body work really hard, such as riding a bike, lifting heavy things, or running. Likewise, you should avoid swimming for at least 6 weeks after your surgery. After 1 to 2 weeks, you may return back to your usual routine, such as going to school or work. Make sure to take the right medication, the right amount at the correct time if you are prescribed any, and attend any scheduled follow-up appointments. If you're having a tonsillectomy surgery, make sure to drink plenty of water to prevent dehydration. Only eat soft foods for at least 2 weeks after your surgery. For example, pudding, yogurt, eggs, mashed potatoes, and soups are examples of soft foods. Avoid eating red-colored foods because this may mask any bleeding after your surgery. Avoid coughing as this can irritate your throat. To alleviate any pain, the patient can include popsicles, ice cream, or cold drinks in their diet. And to avoid constipation, eat foods that are high in fiber or take laxatives. If you're having a myringotomy surgery, you want to avoid getting water in your ear when you shower. For example, do not put your head under the water completely when you take a bath. Your provider may prescribe medicated ear drops, so make sure to take these at the right times with the right amount. Do not blow your nose until 3 days after your surgery. After those 3 days, you may gently blow your nose and open your mouth when sneezing, and this is to avoid the buildup of pressure. Make sure your head is raised with pillows when you are sleeping.
After endoscopic surgery, you may resume a normal diet after surgery, but please avoid eating spicy foods. If you would like to reduce the pain and swelling, you can place a cold pack on your nose for about 20 minutes at a time. When sleeping, make sure your head is raised with pillows, such as this picture to our right. You do not want to be sleeping completely flat. Do not blow your nose or put anything in your nose for 2 weeks after your surgery. To help keep your nasal passages open and remove the dried up blood, you can use saline nasal washes. We recommend that you use a humidifier to keep air in your room moist, especially while sleeping. And when sneezing, keep your mouth open to avoid buildup of pressure. Just like the beginning, you took a quiz. We would like you to take a similar quiz again, just to let us know if you learned a lot and if you enjoyed this presentation. There are our references. And we hope that you learned a lot. Thank you.